Okay, just to recap, we were talking about measurements in the clinic and the fact that these are all inputs into models, so the measurements have to be exact. And I haven't worked with the patients in the clinic. This is kind of unusual because I'm a professor that's not actually working in the lab, so I'm asking you to do something I don't do myself. But I decided a long time ago as a mathematician, and one of the fringe benefits is that I don't have to touch anyone, except maybe my kids. So this is a huge piece though. One of the first things that we saw when we had, and we still will, I haven't had time to invite people here, but we have doctors come here and clinicians come here to give talks on their research, and I always ask them for 1 hour with my students to do some training. And one of the first doctors that came, her name is Dr. Anya Bozy-Westphal, and she said that the most difficult piece is getting comfortable with touching someone. And so one of the first things before you can help yourself out before you actually go into the clinic and work with patients there. You can work with your friends. It's easier to touch your friends than it is to touch someone else. And I would actually recommend working with both genders. I know initially it's a little uncomfortable. It's easier if you're a female to work with a female. Start where you feel comfortable and then see if you can gravitate over towards the other gender and get used to touching different bodies and getting these waist circumferences on different bodies. How many waist circumference tape measures do we have?
I think
We only have one.
We only have one?
Yeah.
Maybe I can buy a couple more so we have more. There's some, or you can get one yourself. They're off of Amazon, maybe $10 is maximum. Get a couple yourself and just measure people. You can actually Google search and get this protocol yourself. The NHANES protocol is what we use in the clinic. For the height, they also have very careful measurements for height. Like I mentioned earlier, height seems like a no-brainer, but people do actually move their bodies when they're on the scale. I don't know if you've seen that, but especially I would think women who are uncomfortable with how their body looks, they might be slouching or doing something different to kind of hide the fact, you start to the neck up, right? That's another thing. Then the head has to be straight up. And it is important to actually get used to doing this with adults because one of the proposals I'd like to pitch out to you is doing a study in children. And children are worse. I can tell you that. Doesn't matter about body shape they'll slouch or they'll do weird things. They'll decide to do this when you decide to get their height. So you have to be a little careful. So this entire set of protocols that are in here for height and weight, we don't do arm circumference. We just do waist. And we do the weight. And what else do we measure? Height. And just in case you don't know, everybody has to know this in here. Body mass index is weight divided by height squared, and the weight is in kilograms and the height is in meters. We have a calculator in the clinic, right? So you can punch in their weight in pounds if you want, and I think you can switch it, and it will automatically calculate their BMI. So the BMI classifications are 18.8 below is underweight, between 18.8 to 25. You have normal. We made a joke, like, what is your BMI? And one of the researchers listening said, I keep it right at 25. Like we watch our bodies all the time to make sure that we're in the right range. 25 to 30 is overweight, and 30 and above is obese. And then 30 to 35 is class 1 obesity, 35 to 40 is class 2, and over 40 is class 3. These numbers are actually the delineation that they have for bariatric surgery. It used to be that you had to have a BMI of over 40 to qualify for bariatric surgery in the States, and they recently reduced that to 35. And there was a lot of bariatric surgery talks. If you went to any of them, they're very, very fascinating because they're different. They do something really different to the person where they end up much healthier than before. But one of the researchers I work with in Sweden says Americans don't like surgery. We're really opposed to the idea of surgery. And the whole view of obesity in the United States is that it's a cosmetic problem. And so to pay for surgery to solve a cosmetic problem in the United States it's frowned upon. So that's one of the very interesting things of these cutoffs that might come into play. So take a look at these protocols, Practice on your friends. Your friends are going to be much more friendly with you after this is over. Try to rack up your hours. I've told previous students to do that, to log their hours. I've done this many, because it looks good on a resume. It's something very specific. Or when you're writing your essays for medical school, you have something very specific to put in there. And then I would say maybe we should start doing this in the clinic, put in a timesheet where people have their hours logged in there, so that when it comes time to apply for colleges or to apply for jobs, they can actually pull off that data from those sheets. Maybe we could do it on the in the computer on an Excel sheet, and put a little reminder on the computer, remember to log your hours. So each student has that to fall back on. Because you'll end up, in the middle of the semester, you'll end up really busy and just going in there, meeting your patient, and you're just going. You don't realize that you need to actually log this stuff for your stuff. And then having that number is great for me too, because I can say, she's put in or he's put in over 100 hours at the clinic. That's much more than he's worked at the clinic. Okay, it's much more specific. Are there any questions about this, the protocols? Do any of you have anything you want to input about the working in the clinic, things to, it would be great to get people starting shadowing. If you want to, I just saw Kim O'Halloran the other day. I can tell her that we're ready to open it up to their college. And she'll shoot out an email. You think we can handle it? We can take as many as we can, and then cut it off and say, we're full right now. Can we place you on a waiting list? Should we do that? That way, these new people can get experience getting in and shadowing right away. Sound good? What do you think, Ruth? Any questions? Okay.